one of the faculties from Institute Sharjah, and today I'm going to discuss some topics related to OET, and I'm dealing speaking topics today. Nowadays the exam is very easy and a few topics are coming, especially regarding preoperative assessments. So today I'm discussing something related to preoperative assessment, how you can deal your task and how it will be. Usually we can start a conversation with a greeting, so it is very important, and we have to use some greetings whenever we are meeting a patient. So we have to consider that it is a normal situation and it is a normal person who is sitting in front of us. So a greeting is very important whatever topics we will get. Then the second thing is introduction. So who you are and what the purpose you are there with the patient. So most probably nowadays they are giving a preoperative assessment situations like any surgery. So some cholecystectomy or some other hernia surgeries or any surgeries they are going to be asked. But the thing is that you are going to be assessed or preoperative assessment should be done. So first of all, make clear that your patient is quite anxious free. So consider your things, that means your standards and your confidence on their care. So you have to prove that, or you have to reassure your patient that they are safe with your hand. So that is the thing, you have to make a trust with your patient initially. Then you can explain regarding the surgical things and preoperative assessment. Sometimes they will ask specific tests like a ECG assessment or some blood test, etc. They are going to be asked. Or otherwise, normal preoperative things like NBO status or some consent things or some kind of investigations like MRSA, etc. So before moving to the direct procedure, make sure they are comfortable with you. So build a trust. After that, you can explain the importance of the surgery as well as the importance of test, how it will help them if they are coming for the assessment. So these all are the things you have to keep it in mind once a preoperative assessment is coming. And read your task properly. Always you have to read, and each and everything have to be analyzed properly. Then as I told you, seriousness of the condition have to be informed. So it is very important. Once if the patient is identifying with the seriousness, definitely it is an easy task to continue with other things. Then if your patient is reluctant, explain some complications whenever they are not going with that. So it is a last end, or sometimes we can call it as if your patient is not okay with the surgery, you can explain serious complications and make sure that you are not threatening your patient. Always use some polite languages in between. So these are the small tips you can use whenever you are going for speaking tasks. Moreover, we have to focus on the speaking assessment criteria, especially the linguistic criteria and the clinical communication criteria. As we all are professionals, so we will always maintain a communication with the clinical. So we will tactfully maintain, or we will friendly cooperate with our patients. So this will be dealt with the communication criteria. And whenever you are speaking, make sure that it is a two-way communication. So don't make your patient silent always. And whenever you are speaking, make sure they are responding with you. So these are the few tips you can maintain with this. And for any doubts, you can contact us. And the next topics, it will be dealt in the next video. Thank you for watching.